Gender-based violence remains a serious problem that has extensive impact across society. Although gender-based violence can be prevented, it continues to be present in every conflict, crisis, and disaster due to gender inequalities that persist across the globe. In light of the alarming gender-based violence crisis context in Ethiopia, a high-level panel was organized under the theme Invest to Prevent Violence Against Women and Girls. This campaign aims to raise awareness on the extent of the gender-based violence crisis and seek increased commitment from development partners to eliminate gender-based violence in crisis context.
The pain, the suffering, the trauma of the women and girls who have survived unprecedented and horrendous sexual and gender-based violence.
About 1 in 3 women have been subjected to either physical and/or sexual violence in their lifetime.
The fight against gender-based violence needs our collective commitment.
Unite, invest to prevent violence against women and girls. It is a pleasure to be here with you today. Our cooperation and humanitarian action program is modest in a very large country with a diversity of actors. We ensure that our actions are aimed at generating synergies, joining efforts, and putting the reality of women and girls at the center of our agenda. May this event be an impulse for greater investment, a stronger commitment, and alliance, so that the entities that work on the ground to reduce all forms of gender violence can continue their work.
The 16 Days of Activism provide us with a critical window to reflect on our progress, challenges, and most importantly, the strategic investment needed to create a safer and more equitable future. Ending gender-based violence and harmful practices against women and girls is one of the 3 transformative results that UNFPA is pursuing in fulfilling the 2030 Agenda for Sustainable Development. And this requires strengthening multi-sectoral partnerships and coordination among a wide range of partners and redoubling our commitment and efforts. The Ministry of Women and Social Affairs and UNFPA have recently led the efforts to develop the national standard operating procedures for gender-based violence prevention and response in Ethiopia.
The ministry has been undertaking major advocacy and mobilization campaigns on the prevention, response of violence against women, as well as comprehensive services for survivors of the violence. Due to the conflict, Ministry of Women and Social Affairs highly engaged and invested in the conflict-affected area to coordinate response and avail means to reach out to the survivors of GBV access services. Like the 3R project is managed and carried out by setting up a coordination office to restore basic services affected by conflict and provide emergency assistance to GBV survivors in order to support the recovery and resilience of Ethiopian conflict-affected communities.
The first panel discussion was conducted with an overview on gender-based violence and crisis contexts in various regions in Ethiopia.
The act that happened on Tagar women is unusual, shocking, and inhuman. When we see the conflict-related sexual violence, nuns, wives of priests and sheikhs, elderly women, young girls, below 10 were gang raped.
The Ministry of Women and Social Affairs, especially in collaboration with World Bank, developed 3R conflict affect resilient response recovery project that under the leadership of ministry is at least in 5 regions under implementation, especially Tigray, Amhara, Afar, Benishangul, Oromia. It is under implementation to respond to those needs of the survivors and women and girls at risk. So there are a lot of efforts that has been made by ministry and in collaboration with as a ministry, increase the number of one-stop center from I think from 36 to now currently around 71, but the most functioning is 51 or 52.
ይሄ ዋን ስቶፕ ሴንተር ብዙ ሴክተር መስሪያ ቤቶችን የያዘ ነው። ፍትህ አለው፣ ፖሊስ አለ፣ ሕክምና ያገኛሉ እዚያው ማለት ነው። ሶሻል ወርከር፣ ሳይኮሎጂ፣ ጋይናኮሎጂ፣ ሰርጅን፣ ፔዲያትሪክ ሰርጅን እነዚህን ያጠቃለለ ባለሙያዎችን የያዘ ነው። እንግዲህ ዋናው ፐርፐዙ የዚህ የዋን ስቶፕ መቋቋም ሁሉንም አገልግሎቶች የትም ሳይንገላቱ የትም ቦታ ሳይሄዱ አንድ ቦታ አግኝተው እዚያው ላይ እንዳልቅላቸው ነው።
It is difficult for us to sustain the safe houses giving service, but we have to give the service because the women who were hiding themselves for 2 years are coming, searching help. So we have to help them. In order to help them, we have to have additional fund.
The next panel discussion shed light on increasing investment in responding to and preventing violence against women and girls.
Investing in GBV prevention and response at a time of crisis is simply too late. So we need to do it beforehand. And it's a very long-term agenda, as we know. It needs to be ongoing. We need to address the legal, the policy, and the practice on an ongoing basis. And studies show that when women are at the center of humanitarian action, the entire community benefits. So I think we really need to challenge ourselves in terms of everybody in the room who's working on humanitarian response, that we are ensuring that women are to the fore, not only in terms of being recipients of humanitarian action, but actually being actors in that space.
In terms of strengthening the service delivery, as I said earlier, there are limited one-stop centers and also safe houses, women and girls friendly spaces which provide a comprehensive service for women and girls. So in that regard, it's important that we allocate enough and sufficient resources in terms of, it can be like human resource or financial resource to support the existing and also establish new structures. Some of the frontline responders have also become survivors themselves. So we have to understand the risks or the context they are operating under, and as an organization and also as a UN agency or as any stakeholder, we have to advocate for this to be considered in every response.
Currently, most of our services are vertical oriented. We are running in when a crisis happens. We go in from Addis, organize and deliver service and come out. We need to start thinking about horizontal service organization where we work alongside the local entities, the local communities, the local leaders to ensure that we build their capacity to take charge. Let us collectively work together to meet the needs of the affected population, mitigate risks and vulnerabilities, and move towards sustainable peace.
I believe we need to strengthen, I think most of you have already said that, strengthen the women organizations at the grassroots level, women rights organizations who have really trying to do as much as they can from whatever they have. But I think we need to build their capacity as well as provide a tailored approach. So we shouldn't always think of them as beneficiaries, as receivers from us. But I think they are very important actors that are missing from any of the discussions that we are doing in peace building as well as humanitarian response.
The high-level panel recommended an increasing resources for initiatives aimed at gender equality in the country in a more effective, efficient, and coordinated manner among the various actors.
Strong institutions can help us not only prevent gender-based violence, but also availing services to survivors. And these services include access to justice, to punish the perpetrators, and by doing so, discouraging any future perpetrator.
Abuse, devaluation of women, taking their rights away, that's just a beginning of a larger oppression. And that's why it cannot be tolerated. It cannot be condoned, and it can never, never, never be forgiven. And that's why we have to maintain our struggle and our fight for women's rights at all the times and in all instances. Women are not victims. They're active agents of change, and they are the ones who have to be in front and have to lead, and we need to come up with comprehensive packages of support. And that means economic support, that means skills, that means livelihoods.
Let our actions speak louder from today's meeting. Carry the spirits of the 16 Days of Activism and take the way and use the stories that we've heard in the united effort to end gender-based violence. And these stories should live on to pave the way for accelerated efforts.